A medida que entramos a la siguiente fase de esta pandemia, cuando los trabajadores y los estudiantes y los maestros regresan a clases, regresan a sus trabajos, queremos incitar a todos a que sigan protegiéndose y sigan protegiendo a su familia, usando máscaras, manteniendo su distancia, lavándose las manos.
Gracias, Ivan. We're proud at Central Health to partner with Community Care, Austin Public Health, and our friends at HEB for what will be a historic effort to provide personal protective equipment, masks, hand sanitizers to the community. And here to discuss the importance of this effort is Dr. Mark Escott, Interim Medical Director and Health Authority for Austin Public Health in Travis County. Dr. Escott.
Estamos contentos de asociarnos con el Departamento de Salud Pública de la ciudad de Austin para poder entregar equipos de protección personal, o en sus siglas en inglés PPE, son máscaras y también sanitantes, y aquí para poder hablar más de todos estos esfuerzos, les invito a escuchar del doctor Mark Escott, es el director médico interino y autoridad de salud pública del Departamento de Salud Pública de Austin.
Thank you, Mike, for the introduction. And I want to say thank you for the hard work that this community has done, which has allowed us to transition from stage 4 to stage 3 of our risk-based guidelines. But it's important to remember that this doesn't mean that we can let our guard down. We have to continue to stay the course. We have to continue the practices which got us here. The masking, the social distancing, the personal hygiene, the washing of the hands, the avoidance of touching our faces, and most importantly, staying home when we're sick.
Quiero agradecer a nuestros socios aquí que están con nosotros, y quiero agradecer a la comunidad y a la ciudad de Austin por todo lo que han hecho, los miembros de la comunidad, que todo lo que han hecho para poder conseguir que lleguemos a la etapa número 3, la etapa número 4, la etapa número 3. Ha sido mucho trabajo, pero no significa que nos tengamos que relajar ahora. Tenemos que seguir manteniendo nuestra distancia, seguir lavándonos las manos y usando nuestra máscara para poder mantener los números de COVID-19 bajos.
It's imperative that we continue to stay the course. We've seen this happen over and over again in communities across America and across the world, that when you let your guard down, that bounce happens, meaning a second surge of cases. So we have to continue, again, those practices which got us to this stage through everyone's hard work. We know the importance of having our children back in classrooms. We know the importance of having our businesses open and thriving in Austin, in Travis County. And together, if we stay committed to this effort to protect ourselves, we will protect our community and those things which we value. That means that we have to continue that effort for quite some time still. We're going to have to continue those efforts until we have a vaccine which is widely available to our community, which is at least 6 to 9 months away in most estimations.
Debemos seguir continuando nuestros esfuerzos. Sabemos que es importante que se mantengan los negocios, es importante que los estudiantes sigan en las escuelas. Sabemos y entendemos la importancia de todo eso. Eso significa que debemos seguir practicando medidas de seguridad. Debemos seguir practicando medidas de seguridad hasta que haya una vacuna disponible, y estimamos que esto no suceda hasta dentro de 6 a 9 meses.
We all have to continue to be aware of the dangers of COVID-19 and understand how easily it's transmitted. Understand how much more challenging it is and how much more deadly it is as compared to things like influenza. That means we have to maintain that caution every time we leave our house. If we're going to school, if we're going to work, if we're going to the store or other places, we have to continue those protections. And it's an incredible example of what this community has been able to do, that we've been able to reach this stage of our risk-based guidance. And that's due to our great partnerships like this one, where we can distribute personal protective equipment, including masks and hand sanitizer, to those who are the most vulnerable in our community, those who are the most challenged by accessing this important equipment. And my hope is that as a community, we will continue to be able to mitigate the risk and drive the numbers down so that we can keep our schools and our businesses open while keeping this community safe.
Sabemos del peligro de este virus, sabemos cómo se transmite este virus y sabemos que es más peligroso que el virus es como la influenza. Así es que queremos incitar de nuevo a las personas, a medida que van al trabajo, que van al supermercado, que van a la escuela, que sigan practicando estas medidas de seguridad. Estamos agradecidos por estas asociaciones o estas colaboraciones como esta, por ejemplo, que nos permite llevar equipo de protección personal a las personas que no lo podrían adquirir. Así es que estamos agradecidos por esta colaboración y de nuevo queremos incitar a las personas a que se protejan y protejan a sí mismos y a su familia.
It's now my pleasure to introduce Stephanie Hayden, Director of Austin Public Health.
Good morning. We at Austin Public Health are so excited to partner with our community groups and organizations like Central Health and Community Care to increase the community access to personal protective equipment. It is essential that everyone has access to hand sanitizer and face coverings and information that they need to use them effectively. As we know, COVID-19 has had a disproportionate toll on those who are already our vulnerable population. Our communities of color have faced decades of disparities, both socially and with health outcomes. While we cannot correct these overnight, COVID-19 has allowed the greater community to understand these disproportionate impacts. Together, we can make a difference.
La directora Stephanie Hayden del Departamento de Salud Pública de Austin habla y dice que por décadas las personas de color, las comunidades de color han sufrido desproporciones en los resultados de salud, en el acceso a servicios sociales. Han sufrido desproporciones en los resultados de salud, lo cual significa que han estado más enfermas y la tasa de muerte es más alta para personas de color. Sabemos que el COVID-19 ha seguido afectando a estas comunidades de color y estamos conscientes de esto, por lo cual queremos de nuevo incitar a las personas a que nos ayuden a protegerse a sí mismos y a proteger a sus familias.
The battle against COVID-19 has been a community-wide effort. As a community, we also need to come together to make sure everyone is protected. As we approach, it's been 6 months since we first identified our first COVID-19 positive case. I want to take this time to thank all of our partners. I would like to thank our hospitals, Central Health and Community Care, as well as Travis County. We have flattened the curve because of the support from our partners. Finally, this launch of PPE distribution campaign We would like to remind the community of a fast approaching distribution event that will take place this Friday from 9 to 11 a.m. September 4th at the Ruiz Branch Library. For additional information, please visit our website at www.austintexas.gov/PPE. Now I will introduce Dr. Alan Schalzer.
Ya van 5 meses desde que el primer caso del coronavirus salió aquí en la ciudad de Austin. Esta lucha en contra del coronavirus ha sido una lucha donde toda nuestra comunidad ha sido afectada y se ha unido a esta lucha. Nada de esto sería posible sin la comunidad, sin nuestros socios como Central Health, socios como Community Care, socios como los hospitales. Gracias a sus esfuerzos hemos podido aplanar la curva de infecciones del coronavirus. Quiero invitar a la comunidad a que nos acompañe a un evento este viernes de 9 a 11 de la tarde para recibir equipo de protección personal. Puede encontrar los detalles en nuestra página de internet austinpublichealth.gov/PPE. And now we would like to turn over the microphone to Elizabeth Marrero. She is the program director for the Central Health Southeast Health and Wellness Center. La directora de programas Elizabeth Marrero para el Centro de Salud Sureste de Central Health.
Okay. Central Health and Community Care are excited to launch this campaign with Austin Public Health and Travis County Health and Human Services. We will be distributing masks, hand sanitizer, and COVID education at community care clinics identified that have the highest positivity rates and highest testing rates in Travis County. Patients will receive PPE kits during their scheduled visits and will have the opportunity to pick up PPE at scheduled pop-up sites throughout the campaign. The first event is with APH this Friday from 9 to 11 at the Ruiz Library. In order to have the highest reach possible, we are partnering with community-based organizations such as the Hispanic Star, Austin Latino Coalition, and the Census Outreach staff to help us distribute PPE to high-risk communities. Central Health is committed to securing 100,000 masks and 25,000 hand sanitizers to keep the community safe. Distribution has begun at the testing sites, with those tested receiving PPE. HEB has generously contributed 10,000 hand sanitizers and $5,000 to support Central Health and Community Care in their efforts to curb the spread of the virus. Now I'll say this in Spanish. Central Health y Community Care estamos entusiasmados en empezar esta campaña con Austin Public Health y Travis County Servicios Humanos. Vamos a repartir mascarillas, desinfectante de manos y educación sobre COVID en las clínicas de Community Care identificadas en áreas de altos números de positividad y que tienen pruebas más altas. Los pacientes recibirán equipo de protección personal durante sus visitas programadas y tendrán la oportunidad de recoger EPP en sitios programados durante la campaña. Para alcanzar más pacientes, nos estamos asociando con organizaciones comunitarias como Hispanic Star, Austin Latino Coalition y personal del censo para ayudarnos en distribuir EPP a comunidades de alto riesgo. Central Health se compromete a asegurar 100,000 mascarillas y 25,000 desinfectantes de manos para mantener la seguridad de la comunidad. Hemos empezado en los sitios de prueba y los examinados reciben EPP. HEB ha contribuido generosamente con 10,000 infectantes para manos y $5,000 para apoyar a Central Health y Community Care en estos esfuerzos para reducir el virus. At this time, I'm going to introduce Dr. Shasha, who's the Chief Medical Officer for Community Care. En este momento va a hablar Dr. Shasha, es ejecutivo de servicios médicos de Community Care. Gracias.
Good morning. Since mid-March, Community Care has tested over 26,000 individuals, and the cumulative percent positivity rate, now that is additive, so it's since March until now, we have a positivity rate of 27.4. Having said that, percent positivity has been decreasing within the past 4 to 5 weeks, and we need to keep that decrease going. For some of our subpopulations, for those that are Latino within our scope, the percent positivity in late July was in the upper 39 percentile. It's now at around 19%, so again, headed in the right direction. For those who are African American within our scope, the percent positivity as of the week of August 23rd is about 7.1, and at the height of COVID for our African environment, we were hitting a percent positivity of about 31%. For those who suffer from health inequities, there's a greater risk for diabetes, there's a greater risk for hypertension, there's a greater risk for obesity, and if they attain COVID, the outcome could potentially be much worse. Again, we need to be rigid, we need to be proactive in our approach, specifically as we head into Labor Day, about social distancing. If gathering in groups, in family groups, or with family and friends, please try to gather in groups less than 10. If you are going to get together, please sit outdoors, socially distance, and wear masks. We hope that you enjoy the Labor Day weekend. Stay safe.
Los sitios de prueba de Community Care desde mediados de marzo han administrado más de 26,000 pruebas. La tasa de positividad general para las pruebas de vueltas es del 18% desde el 26 de agosto. Esa tasa es inferior a nuestras tasas de positividad más altas registradas en julio, las cuales eran de 36%. Son buenas noticias, pero debemos permanecer cautelosos y vigilantes. Debido a las desigualdades sistémicas en la salud y otros factores, las comunidades de color son más vulnerables durante esta pandemia. Las personas de color a menudo tienen tasas más altas de infecciones subyacentes como la diabetes, obesidad, presión arterial alta, lo que a menudo hace que sus casos de COVID-19 sean más graves. Los latinos todavía están dando positivo por COVID-19 en tasas más altas que los no latinos, que actualmente es una tasa de 23%. Así que a medida que nos reunimos más con familiares y con amigos, recuerde, si conoce a otras personas o si se encuentra con otras personas en persona, mantenga la reunión pequeña, a menos de 10 personas. Organice su reunión al aire libre, si es posible. Si no es así, asegúrese de que la habitación o el espacio esté ventilado. Abra una ventana o una puerta o todas las ventanas y las puertas. Manténganse al menos a 6 pies de distancia de otras personas que no sean de su hogar. Y lo más importante, quédense en casa y aislados si tiene algún síntoma. Disfruten este fin de semana, de día de trabajo, pero manténganse seguros.
I'd like to introduce Tim and Ofelia Zapata, who are going to present the patient perspective.
Y ahora nos hablará el señor y la señora Ofelia y Tim Zapata para darnos una perspectiva del paciente.
Good morning. My name is Tim Zapata, a member of San Jose Church. My wife and I got the coronavirus at the same time. The hardest thing to help my wife, I was so sick. Most of us men think that nothing can bring us down. We believe as strong as we can fight anything. Let me tell you, this virus brings you down to your knees. The virus takes control over you. This virus is a fight that we cannot control. It takes all your energy and we cannot fight back. I learned to appreciate a good night's sleep without pain all over my body. Husbands, fathers, brothers and uncles, grandfathers, the coronavirus is deadly. It respects nobody. Love your families enough to stand strong together as a community to protect ourselves. Be healthy, safe, and wear your mask. Thank you.
Mi nombre es Tim Zapata. Mi esposa y yo contrajimos el coronavirus al mismo tiempo. Lo más difícil para mí fue que estaba tan enfermo que no pude ayudar a mi esposa, que es ciega. La mayoría de los hombres pensamos que nada puede derribarnos. Creemos que somos fuertes y podemos luchar contra cualquier cosa. Este virus me trajo a mis rodillas. Me sacó toda la energía. Estaba contento de dormir toda una noche, ya que el virus causaba que me doliera todo el cuerpo. Ahora mi esposa.
Good morning. My name is Ofelia Zapata, a member of San Jose Catholic Church. Also, 6 of my family members and along with us got the virus the same week. We live in different parts of the city. We did everything to protect ourselves. We followed all the rules to sanitize our homes constantly, to washing our hands all the time and wearing our mask anytime we left home. Still, the virus hit us. The virus is everywhere. Having the virus was painful. It was sad. It makes you feel helpless and hopeless. There's a quote from Pope Paul who says about the social consequences of the pandemic. We want to resume to more normality and return to economic activities. This normality should not include social injustices. The pandemic is a crisis. Either we come out of it better or we come out of it worse. On behalf of the community, I want to thank our Central Health, Austin Public Health, and all the hero nurses, the doctors, and the essential staff for helping Austin, the Austin community, to stay healthy and safe. Thank you.
Buenos días, mi nombre es Ofelia Zapata. Mi esposo y yo seguimos todas las reglas para protegernos del coronavirus. Nos lavábamos las manos frecuentemente, sanitábamos nuestra casa con frecuencia, nos manteníamos a distancia de otros y aún así contrajimos el coronavirus. Tener el virus fue doloroso, fue triste. Uno se siente impotente y desesperanzado también. Queremos agradecer también a nuestros socios, a las organizaciones tales como el Departamento de Salud Pública, también así Central Health, Community Care y muchas otras organizaciones que han estado ayudando a toda la comunidad a luchar en contra de la pandemia. Esta pandemia es una crisis y debemos de todos unirnos para poder luchar contra ella. Gracias.
So on behalf of all of our partners here at Community Care and Austin Public Health, We want to thank all the community groups that are out there helping to fight this pandemic. Austin Latino Coalition, Community Coalition for Health, the Bell Valley Community Coalition, the schools, and there are many, many other organizations that are helping us in this great historic effort, and we want to thank everybody.
De parte de todos el personal en Central Health, queremos agradecer a todos nuestros socios, no tan solo los socios que son proveedores de salud médica que ya hemos mencionado, pero también a todos los socios comunitarios, tales como la coalización o alianza de latinos de Austin, también así la alianza comunitaria de la salud y muchos otros que nos han estado ayudando para poder luchar contra esta pandemia. Muchas gracias.
Okay, we had a question from KXAN. Can you please ask how many sites will be involved, where they are, and for how long will the PPE be distributed? Also, who is paying for the PPE beyond what HEB is donating?
So at this time, we're going to target the eastern Travis County sites, which like Maynard, Del Valley, Hornsby Bend, Southeast, and then we'll move out to the other sites as we begin distributing it to patients. So we're going to give them a certain amount of PPE to give the patients as they're coming for the week. And then we'll expand out to the clinics. We're looking at up to 20 community care clinic sites to provide the PPE for their patients. And then we'll also have pop-up sites throughout the 6-week campaign, which will run us to about mid-October, where the public and community care patients can also access the PPE in larger amounts. Right now we're receiving some funding from from HEB. We're working with some community organizations that are also donating some PPE, possibly through Procter & Gamble. And then we've also set aside a certain amount to purchase our own PPE in case we don't get the funding from outside sources.
There was one follow-up question, which I don't know if you can answer this or not. Which areas or zip codes are the distribution event taking place in, and what was the criteria to designate an area as a hotspot?
Oh yes, and they can visit the Austin Public Health /PPE site that's live. We've sent our locations to there, and it's constantly going to be updated. They have the dates through September right now. And then what was the other part of that?
What was the criteria to designate an area as a hotspot?
We looked at zip codes that had the highest COVID rates of positivity and also the highest testing rates. So the areas that were highest risk, those were the zip codes that we were in. So for instance, the 4-1, the 4-4, the 2-3, the 2-4, and those zip codes.
And can you give us that website address?
Yes, it's austintexas.gov/PPE.
Okay. And then we had a question for Dr. Escott.
Mike, can she
yes,
say that
sorry.
in Spanish?
Yeah.
Okay. Ahora en español, había una pregunta sobre cuáles clínicas íbamos a distribuir la protección personal. Vamos a empezar con la área del oeste con el 787-24-787-23, el 41, el 44. Todos los pacientes de Community Care, empezando la próxima semana, van a poder recoger protección personal cuando vayan a sus visitas. Se los van a dar y después vamos a tener diferentes eventos para que tengan oportunidad de recogerlo también en esos sitios, diferentes sitios.
Bring up Dr. Escott. We did have a question. So for Dr. Escott, speakers have mentioned providing info about how to use the PPE and other precautions. Can you provide any of these details here? what are the things people may not understand about how to use PPE or implement other precautions?
Sure. The most important thing about wearing a mask is it needs to cover your nose and your mouth to be effective. Remember, the masks are to protect other people from the person wearing the mask, not the other way around, particularly in terms of the cloth face mask. So when you put these on, it's important to not touch the inside of the mask. If you need to touch the mask, touch the outside, or if it has ear loops, the ear loops. So when you put it on, you do it like that. When you take it off, it's like that. You know, a lot of people ask about things like wearing gloves. Gloves aren't really essential to wear. Remember that COVID-19 is a respiratory virus. So it's going to enter us by our nose, our mouth, and our eyes. So the take-home point there is avoid touching your face with unclean hands. And that's an important lesson, particularly if you're new to wearing masks. You don't want to constantly be touching your face to adjust it. So in terms of getting your children ready for school, where they're going to have to wear masks, now's the time to start that process. Have them wear masks at home so they can become used to it and can avoid touching their face too often.
La pregunta es, ¿qué puede uno aprender o cómo puede uno usar el equipo de protección personal? ¿Cuáles son las cosas que uno debe de hacer? ¿Cuáles son las cosas que uno no debe de hacer? Es importante mencionar que la máscara es para proteger a otros, más que nada, a otras personas. Entonces, ¿cómo ponerse la máscara? Deben de agarrarla de las orejas. Primero que nada deben de agarrarla de las orejas. No tocarla de adentro, no tocarla de afuera, para poder mantenerla limpia. Y así se la ponen. Ahora, lo segundo es que ahora las personas están, este virus es contraído por el sistema respiratorio, ¿verdad? Hay mucha gente que dice que se pongan guantes. Los guantes no son esenciales. ¿Por qué? Porque este virus se contrae del sistema respiratorio, lo cual significa que se contrae por la boca, por la nariz o por los ojos. Así es que cuando hablan de guantes, lo importante es lavarse las manos con frecuencia y no tocarse la cara cuando tenga las manos no lavadas o sucias. Entonces, ahora que los niños y los estudiantes van a regresar a la escuela, para que se acostumbren a traer la mascarilla puesta, les recomendamos que de una vez empiecen a ponerse la mascarilla en la casa para que se empiecen a acostumbrar.
Will Dupree here in the KXAN Live studio. Thanks so much for hanging around with our stream for a while. We did have some audio issues in the beginning coming from this feed that Austin Public Health, Community Care, and Central Health put out there to talk about this new distribution effort to hand out face mask and hand sanitizer and other essential information about how to stay safe during the COVID-19 pandemic. What they did announce is that there will be a free giveaway this Friday here in Austin, and I want to bring up this particular website. So Austin Public Health and the city itself have launched a new website called austintexas.gov/PPE. That, again, is a personal protective equipment. Let me get that right. And here they have published a list of distribution sites that will be happening in the weeks to come, the first being this Friday, September 4th. So we're going to take that full screen so you all can see. The first distribution will be held at the Austin Public Library's Ruiz Branch. That's at 1600 Grove Boulevard here in Austin. Again, Friday, September 4th from 9 to 11 a.m., and then again on Friday, September 18th, 9 to 11 a.m. Additionally, there will be a distribution at Santa Barbara Catholic Church at 13713 FM 969 here in Austin. That's on Saturday, September 12th from 9 a.m. to 11 a.m. There's another one happening at the Consulate of Mexico here in Austin at 5202 East Ben White Boulevard, Suite 150. Wednesday, September 16th from 4 p.m. to 6 p.m. And then finally there you see there's another one at the Gustavo Gus L. Garcia Recreation Center at 1201 East Runberg Lane. That's on Tuesday, September 22nd from 9 a.m. to 11 a.m. I'm going to lead this up so those of you who are watching our live stream can maybe jot down these details. But once again, you can find it at austintexas.gov/PPE. We will write up the information that was just shared by those 3 entities and other community groups who are joining a part of this, and put this all on our website, kxan.com, and on the KXAN News app, so you can download that and access all of this there. Again, Austin Public Health, Community Care, and Central Health are starting a distribution campaign to give away face mask and hand sanitizer to help people stay safe during the ongoing COVID-19 pandemic. We will put all these details on our website and on our app, so please download that and check that out there. Thank you again for watching our stream for as long as you have. We appreciate that. I'm Will Dupree here in the KXAN Live studio. We'll see you back here another time. Please, everyone, stay safe and stay healthy.